Hello, and thank you for joining me. I am Dr. Liz Plowman. I'm a physical therapist, and I am the Myasthenic PT. Today's episode of the webcast is all about pain with Myasthenia Gravis. Now, this is a bit of a controversial topic because there's a big debate over whether or not Myasthenia Gravis actually causes pain. I feel it's important to address, though, because I encounter many people with Myasthenia Gravis that frequently report pain with their MG symptoms. Unfortunately, these complaints are often dismissed with explanations such as, MG doesn't cause pain, therefore you can't possibly have pain, or pain is coming from something else, or, and even worse, you must be imagining it, it's all in your head. Now, as a healthcare provider, I am appalled by this dismissive attitude toward a patient's very real symptoms. I see many patients with MG who have some degree of pain associated. So I'd like to take some time today to talk about pain in the context of MG. Now, this webcast might be a little longer than usual, but this is a topic that I'm very passionate about, and I have a lot of information to share, so sit back, relax, and let's get going. First, let's start by learning a little bit more about pain. There are a lot of misconceptions floating around out there about what pain is and how it works. So we're going to start by clearing this up. So what is pain? We have wrestled over the definition of pain for centuries, and we are still wrestling with it. In the 17th century, the formal definition of pain was a negative sensation in direct response to a painful stimulus or injury. So you put your foot in the fire, you sprain your ankle, you cut your hand, and you feel pain. When the stimulus is removed, when you take your foot out of the fire, or the injury heals, when the cut on your hand heals or the ankle sprain heals, then the pain goes away. It's an elegant theory. Simple, easy to understand, but wrong. Now we know pain is far more complicated than that. That theory doesn't account for things like pain without injury, injury without pain, chronic pain, pain memory, or any other number of painful sensations. So without going into a mini course in neurobiology, we now understand that pain is a negative sensation generated by the brain in response to a perceived threat or danger to the body. And the pain experience can be affected by many factors, including sensitivity of the nerves, medication, both positively and negatively, the body's immune response, and an understanding of the pain's origins, which actually helps to decrease the perceived threat or danger. The big thing I want you to take away is that pain does not equal injury or damage to the tissues of the body. Pain does not equal tissue damage. I'm sure you have all had an experience where you've had pain in a part of your body and no recollection of an injury. It just hurt for no reason at all. I'm also sure that you've had a bruise or a cut or a scrape with no recollection of how you got it. These are examples of pain without injury and injury without pain. Simply put, the two, pain and injury, do not necessarily go together. It's very common for someone experiencing pain to immediately believe that there's something very wrong and that they have an injury. But it's important to keep in mind that this is not always the case. So with that in mind, let's talk about pain with Myasthenia Gravis. Now, not everyone with MG experiences pain, so it's not considered a common symptom. Strictly speaking, MG causes muscle weakness and fatigue. Essentially, the nerve and the muscle are blocked from communicating with each other, so the muscle cannot contract effectively. And this, in and of itself, is not painful. It's experienced as weakness or an inability to use a muscle, not as pain. This is considered a primary symptom of MG because the impairment is caused as a direct result of the disease process, the blocking of the communication between the nerve and the muscle. Depending on what muscle groups are affected, this will also directly cause what we call functional impairments, which might be things like going up the stairs, difficulty with lifting or carrying objects, breathing issues due to weakness of the diaphragm, and changes in the way you walk or get around. These are all considered primary symptoms and impairments of MG. Secondary symptoms are things caused by the primary symptoms, and this could include pain. For example, muscle weakness and changes in the way you walk can change the forces on your joints and may cause joint pain as a result. Or if you have less affected muscles compensating for more affected muscles, then you may experience pain and soreness in those less affected muscles simply because they're getting a lot more use than they're used to. This is why some medical providers do not consider pain a part of the MG experience because it's not a primary symptom, but it is reasonable to consider it a secondary symptom. As I mentioned earlier, pain can be affected by medication and immune response too. So have you ever noticed that when you're sick with something like the flu, body aches go right along with that? There's new research that has indicated a link between the pain experience and the body's immune response. A common and very well documented complaint when tapering off the immunosuppressant drug prednisone is body aches. The current thought on this is that changes in the body's immune response brought about by changing the dose of prednisone can cause pain. If you're having a flare-up of your MG, which is an autoimmune disease, I don't believe it's unreasonable to think that some pain could accompany that. Again, not everyone has pain. Not everyone has this experience. Remember, MG is nicknamed the snowflake disease because no two presentations are alike. But if you do have pain, not to worry, you are definitely not alone. Lastly, it's very important to remember that pain may or may not be related to your MG. I think we've already established that it's perfectly reasonable for pain to accompany MG symptoms. But don't forget that we are still human beings, and as such, we are susceptible to back pain, neck pain, etc., just like anyone else. One thing I see a lot of is a belief that every experience or discomfort has to be related to MG. For people dealing and living with MG, the condition takes up so much of our time and our energy, so I can see how it can become the entire focus. I get questions like, I stubbed my toe, is it my MG? Maybe, or maybe you just stubbed your toe. Now I say this as an attempt at a little humor, but it's important to remember that we are more than our MG, and we are just as susceptible to other conditions too. There are many conditions that have a pain component. For example, the widespread deep, achy pain and hypersensitivity caused by fibromyalgia, the multi-joint pain caused by rheumatoid arthritis, and so on and so on. So where does this leave the person with MG who's experiencing pain? 1, don't stress about it, because believe it or not, that actually heightens the pain experience. 2, feel validated that pain can and often does accompany MG. And feel validated that you are by far not the only person with MG to experience pain with this condition, regardless of the controversy surrounding the topic. 3, communicate with your healthcare provider. Logs and descriptions of what you're feeling is very helpful. 4, move around, without over-fatiguing, of course. Staying still tends to make joint and muscle pain worse, whereas gentle movement tends to relieve it. And 5, work with a specialized healthcare provider, preferably a physical therapist who can help you work through your pain, especially if your pain is keeping you from doing the activities that are meaningful to you. So thank you so much for joining me on the webcast today. I know this one has been a little bit longer than the norm, so I appreciate your time and attention. This is a subject that I know affects many people, and as a physical therapist who works with MG patients as well as chronic pain patients, this topic is very near and dear to my heart. If you would like to know more, or if you have questions, please feel free to reach out to me. My email address is themyasthenicpt@gmail.com. It's also listed in the description below. If you're interested in working with a specialized physical therapist who can help you address MG as well as pain, send me a message and we can have a conversation to figure out the best plan for you. Now, if you're a physical therapist and you need some guidance working with the MG population, I would love to hear from you as well. Thanks again for joining me. It means the world to me that you tune in. Do me a favor, hit like and subscribe so that you'll be notified of my next webcast. And please share this video with anyone that you think needs to see it. Until next time.